When do they come back? So
not soon enough, but you know what, it didn't matter. But anyway,
Yeah.
I'm getting nasty. I'm having a perimenopausal moment. Well, I'm beyond perimenopausal. I'm having a menopausal moment, so let's just leave it alone. Okay, so with the fascia, good skin integrity and good fascia release is that there's supposed to be a pliability here. You see how I can pick this up? Okay, and here. If there's an area where you can't pick it up, like here, right, that's an area that there's tightness there. Okay, and the bad thing about this tightness is that it can create, because the fascia now is compressing against the muscle, it can limit mobility. It could also create pain, and because this one's right on the spine, it could also be compressing against the nerve, and that's where a lot of people just get a lot of pain and discomfort. And they don't know how to deal with this. They take painkillers or whatever. And the massage might relieve it, but because the fascia is still tight, it doesn't matter. So now you have two different types of ways of the first thing that you want to assess as using massage is the skin integrity. So you want to make sure that there are no rashes, there's no openings. And then you want to, and in the skin integrity, you want to assess the pliability of the skin. So you see how I'm coming together, my hands are coming together and then pulling up his skin? That's called a direct contact. An indirect contact is that I'm pulling away. And in the indirect contact, I want to see the skin move with my pulling away. The other thing is, another way to do it is to, almost like that ringing, you're looking up and you want to see how the skin moves, circular, and if you feel a resistance, that means there's a tightness here. So Harry tends to be very loose here, and tends to be very loose here. But then when I come over the shoulder areas, I can see some looseness here, but then some resistance here. So this is the area that we'll work at. Okay. So I'm putting my hands here. I'm keeping about a 1 inch apart, and now I'm going to use direct release. So I'm coming in together and then trying to get some movement up here. I'm not pressing down hard. I'm not squeezing. It's not like popping a pimple or anything like that. Okay. I'm just trying to get the layers of the fascia up and going. And now you're seeing some redness, and that's because of the histamine. And you can also come in this way as well. Now, I'm sorry. Let's see now how I can actually pick up some of that skin. And you'll feel like, as I'm going through it, you could feel it like creaking a little bit. And that's the fascia. Does it feel, Harry? Now, another technique, and this one is not painful, okay? And it's just simply picking up the fascia and moving it up.
When would you use the indirect one? Do you? No?
There's like no hardcore science to this. You use whatever gives you the most mobility. And you'll see the redness, and you feel a temperature difference. This is like really hot, and this is really cool, and that's because this is getting a lot of blood here. And the histamine release is happening. But now I can pull it up, and I'm not digging as deep as before. Another one This one's a little bit more painful. It stings. It's not that it hurts, but it stings. But it's faster and it's great to cover the whole back. This one's really nice when people have like severe back pain. So you're picking up the tissue and you're kind of like rolling it with your fingertips and your thumbs are pushing it up. And it leaves a streak of redness when it's done right. And this one affects the whole fascia in the back a lot faster.
How do you know how much pressure to give, just so you have some skin between your fingers?
Yeah, I'm not giving pressure, I'm just pulling it up. And, you know, you could do this in all directions of the... And again, this is a quick thing. Okay. Most of this is done in the back. I do the back ones because of the OT, you know, with the shoulders. And you can use a combination of them. You can see I'll do with that one, and then I'll do this one, do the direct, and then I'll do the indirect.
Do you get to all the fascia and all the different muscles in the shoulder, like subscapularis and
Yeah.
teres and all that fun stuff?
Well, not the deep ones, but